everyone, this is Mary Rose Garcia, and for today's video, I'm going to perform perineal care demonstration. So, perineal care is the aseptic cleaning of the vulva and the perineum of the patient. For the assessment, we have to review the general assessment data of the patient and also observe for perineal itching and burning sensation during urination or skin irritation, and ask the patient if he or she experiences any of this problem. Also, we have to assess the patient's ability to bath him or herself and perform a perineal care by his or herself. Also assess patient's learning needs related to perineal care, and while bathing or while providing privacy to the patient, assess the perineal or genital area for any abnormalities. So for the objectives, it is to keep the vulva and the perineal clean, to promote healing of the perineal wound, to prevent infection, to prevent disagreeable odor, and also to promote comfort to the patient. For general considerations, always take note that the flushing water should be in the right temperature in order to avoid burning to the patient. Also, we have to observe special care when a patient has a perineal wound or stitches to avoid much discomfort. And if the patient defecated or voided, empty the bedpan first before doing the perineal care. And lastly, discard used perineal balls onto the waste receptacle, not on the bedpan.
So for preparation, we have to prepare all the equipment. So we have here the flushing tray containing the packed dry perineal balls, bottle of sterile soap sod solution, flushing pitcher with warm sterile water, and also, for example, this is our pick-up forceps soaked in Sidex solution. We have also extra sterile forceps, our waste receptacle, the ordered medicine, tissue paper, rubber protector, our bedpan, our perineal pad, and our bath towel, lastly our gloves.
So first, we have to explain the procedure to our client and its purpose in order to gain cooperation from our client and also to allay anxiety. So, good day, I am your nurse for today, and our procedure is perineal care, which is I'm gonna clean your vulva and perineum area, and it is where we can prevent infection and also prevent disagreeable odor onto your genital area and your perineum, and also to provide comfort. So all you have to do is to follow what I say and please cooperate. Thank you. So after that, we have to screen the patient to provide privacy. Then we have to wash our hands and wear gloves. So after wearing gloves, you have to remove the patient's perineal pad, if any, and then wrap it in a paper and throw it or discard it in a waste receptacle or waste can. So Miss, I'm gonna take off your perineal pad, okay? And then wrap it in a paper. And discard. And then loosen the foot part of the top sheet, then place the patient in a dorsal recumbent position. So dorsal recumbent position allows the patient to lift herself onto the bedpan. So Miss, I want you to flex your legs. Next is to place the rubber protector against the patient's buttocks to protect the linens from getting wet. So, Miss, I want you to turn your side, or if you can't do it, I could assist you to do it. Okay? Okay. So, you want me to assist you? Okay. Turn your side. Next is to place the patient on bedpan. Front fold the top sheet towards the knees and to expose the vulva and perineum. So put a bath towel over the abdomen. Providing privacy avoids overexposure and the bath towel protects the gown from soilage. So he already placed the patient on bedpan. Then expose, front fold the top sheet, expose the vulva and the perineum. And then put a bath towel over the abdomen of the patient. Next is to pour a sterile water over the vulva. This is to rinse off the urine, the fecal, and the vaginal discharge using warm water. So warm water helps in relaxation of nerve endings. There's still water. Then we have to clean the vulva and the perineum using our perineal bowl soaked in solution. So use a downward stroke. So first, we will begin at the center of the vulva using the downward stroke. Discard. So always remember to use a fresh perineal bowls for each stroke and repeat each sequence of cleansing as necessary. Then, after the center, proceed to the further labia minora. Discard. The nearer labia minora. Discard. Further labia majora. Near labia majora. And lastly is the center of the vulva, the mons veneris, and the mons pubis. Discard. So we use the downward stroke in order to prevent the contamination from the rectal area. Cleansing an area where there are few organisms before cleansing one with numerous organisms minimizes the spread of organisms to cleaner areas. So always remember to discard the used perineal bowls into the waste receptacle to prevent the spread of microorganisms. After that, we have to rinse the area with warm water. So, for example, this is our warm water. See to it that the solution is completely rinsed off. Next is to dry the vulva and perineum with the dry perineal bowls following the same sequence in cleansing. So, this enhances patient's comfort. Wet or moist environment cultures bacterial growth. So following the same sequence, we'll spread the labia, pat to dry from the center of the vulva, discard. The further labia minora, the near labia minora, discard. Further labia majora and the near labia majora. Center of the vulva, the mons pubis and the mons veneris. Discard. So next, we have to remove the bedpan of the patient and turn the patient near you. So this position makes it easy to dry buttocks and anus, and working close to an object prevents overstretching, which may cause muscle strain to the nerves. Remove the bedpan. And then, okay, knees, I want you to turn to your side. Okay, I will assist you to turn towards me. 1, 2, 3. So after that, we have to dry the buttocks and the anus using our tissue paper. So tissue paper as a mechanical means helps in cleaning the area. So discard. Position. Stop. Next, you have to assist the patient to assume a dorsal recumbent position to apply medication as ordered and perineal pad if necessary. So prompt attention to details of patient's comfort and confidence. Discharges from perineal area are absorbed by the perineal pad. So fan fold. So knees, I need you to flex your knees and then spread. Okay? Then we need to apply our ordered medication. For example, this is the prescribed medication by the physician. And then provide a perineal pad. So lastly is to remove the bed protector and arrange the beddings and make patient comfortable. Since an orderly environment is conducive to health and helps and keeps the unit clean and neat. So, Kainis, I want you to turn to your left side. Okay, I assist you to turn to your left side, okay? To take off your bed protector. 1, 2, 3. Turn. Very good. And after that, arrange the beddings of the patient and leave the patient comfortable. Kinis, do you feel comfortable? Good. So after that, we need to dispose our gloves and then wash our hands. So for the evaluation, perineal care has been effectively and comfortably provided. Also, the perineal area of the patient is clean and odor-free. So that would be the coverage of our perineal care procedure. Again, this is Mary Rose Garcia, a second nursing student from Section Marimbak. Thank you and God bless us all.